Welcome to The Explainer. Today, we are diving into a test that could be the final crucial step in your journey to practice medicine abroad. It's called the Occupational English Test, or OET for short. So, if you are a healthcare professional dreaming of working in an English-speaking country, stick around. This one's for you.
Look, you've put in the years, you've honed your medical expertise, and you are, without a doubt, a skilled professional. But here's the million-dollar question. How do you prove you have the communication skills to match? How do you show a regulatory board that you can connect with patients clearly and with empathy, in English? That is the exact challenge we're going to break down today.
All right, so here's our game plan. First, we'll talk about this professional English hurdle and why it even exists. Then we'll introduce the OET as a test that's tailor-made for this situation. We're going to look inside the 4 parts of the test, really understand why it just makes sense for healthcare pros, and we'll finish up with a clear, actionable plan to help you pass.
Okay, let's start with what we're calling the professional English hurdle. You know, for so many incredibly talented people, this can feel like the last wall standing between them and that dream job in a new country.
And here's why that wall exists. It's a non-negotiable requirement. Before you can get registered to practice by medical boards in places like the UK, Australia, or Ireland, you absolutely have to prove your English skills. And it's not just bureaucracy, right? It all comes down to patient safety and making sure communication is crystal clear within the entire healthcare team.
So the big question is, how do you actually prove it? Well, that brings us to a test that was built from the ground up for people just like you. Let's talk about the Occupational English Test.
The OET is not just another English exam. I mean, look at this definition. Its entire reason for being is to assess the communication skills needed in a healthcare environment. It's not about random academic topics. It's designed to test you in your world using scenarios you already understand.
And we're not just talking about doctors and nurses here. The OET is specifically tailored for 12 different healthcare professions. So whether you're a dentist, a pharmacist, a physiotherapist, or even a veterinarian, there's a version of this test that uses the language and the situations that are part of your everyday work life. So, what does this test actually look like? Let's pull back the curtain and get right into the heart of the exam. We're going inside the 4 subtests. Okay, here's a quick overview. You've got listening, reading, writing, and speaking. But here's the most important thing to see here. Every single task is grounded in a healthcare context. In the listening part, you're following consultations. The reading section uses actual clinical texts. It's all designed to feel familiar.
Let's zoom in on the writing test for a second. This isn't about writing some abstract academic essay. No way! You'll get a set of patient case notes and be asked to write a professional letter. Maybe it's a referral to a specialist or a discharge summary for a family doctor. You know, a real-world task you probably already do.
And the speaking test is just as practical. Think of it like this. It's not some random chat. It's a couple of role plays where you are the healthcare professional, the nurse, the dentist, whatever your field is, and the examiner plays the part of a patient or a worried family member. You're literally acting out a clinical scenario.
So all of this leads to a really important question. Why would you choose OET over another English test? Well, it really boils down to using the right tool for the job.
I mean, when you put OETs side by side with general English tests, the difference is night and day. Other tests might ask you about, climate change or art history. The OET tests your ability to communicate in real healthcare situations, using the specific language of your profession. You're not just studying for an exam, you're actually preparing for your career.
So what's the real advantage here? It's huge. You're not trying to cram a bunch of new academic words. You're leveraging the professional language you already use every day. And that means you're building genuine confidence for your first day on the ward and for all those critical patient interactions that are coming your way.
Okay, so the test clearly makes a ton of sense, but how do you actually prepare for it? Let's get into our final section and lay out a clear strategy, your path to passing.
It doesn't have to be complicated. Here's a simple 4-step plan. First, you've got to know the test format inside and out. Second, please use the official prep materials. They are the gold standard for a reason. Third, and this is so important for the speaking part, you have to practice those role plays with another person. And finally, think about getting some expert feedback to help you spot and fix your weak spots.
And the good news is you don't have to look very far for help. The best place to begin is the official OET preparation portal. Beyond that, amazing sources like Cambridge University Press and the British Council have top-notch materials. And of course, there are plenty of specialist online courses that focus only on OET prep.
As you get into your preparation, just try to remember this one thing. The real goal here is not just to get a good score on a test. It's about proving to yourself, to your future colleagues, and most importantly to your future patients, that you have the high-level communication skills that this job demands.
At the end of the day, the OET is the bridge connecting your skills right now to your future career. It's your chance to show the world that you are ready for that next step. So I'll leave you with a simple question. Your patients are waiting. Are you ready to talk to them?